Thank you for coming this Dentium consensus meeting today. It is my great honor to have a presentation here with you. And also, I deeply appreciate Dentium company to give me a good chance to share my clinical the experience with you. Today's topic is collagen graft with bright TL, the actual synergy between both of two materials. Let's see. As you know, this frequent happen patient case, endodontic root canal treatment and the crown patient and fractured and coming to my clinic. And this kind of cases, as you know, it is a good candidate for immediate implantation. So extraction of tooth and the GBR procedure. Unfortunately, during the extraction procedure, the labial bone plate loss. However, these canine areas is even enough to have implantation with a normal size and make a contained defect also. So put the implantation and bone grafting and barrier membrane application, as you know, as you can see. So pin fixation with this collagen membrane. All of these procedures are general procedures, as you know. Okay, and the primary closure. After that, this is waiting time. For 6 months later, we can see we can get the very nice, well done, newly forming bone like this situation. So we always try to have this, keep the past principle. These principles are published and suggested 2006, actually 20 years ago. However, until now, this past principle ruling and the controlling and all of these principles and all of these GBR procedures, the primary closure and angiogenesis, space maintenance, and stability. For me, the stability is most important factor also during some of the modification of GBR procedure. Anyway, this one is pre-op situation and the final restoration here. And 4 years later, follow-up conbeam CT view. The labial plate are still there and very well organized around this, the labial portion of implant fixture. So, I think GBR principles and the barrier membranes working as follows. First, these barrier membranes exclude epithelial connective tissue cells that can maintain space. And third, stabilize blood clot and support osteoblast proliferation. All of these, the actions and came from the barrier membrane. However, unfortunately, some of barrier membranes, including collagen membrane and the non-resorbable membrane also, have some limitations. What kind of limitation? The inflammatory response during degradation. All of these, the resorbable membrane have a degradation process, you know. So during the degradation process, collagen degradation products may trigger local inflammation sometimes and foreign body reactions also. And another some discomfortness and limitation of barrier membrane is here. Susceptibility to membrane exposure and infection. So sometimes collagen membranes are highly sensitive to oral exposure. So leading causes of GBR failure. Okay, what do you think about this one? Yeah, tragedy, right? So we never want this situation. Anybody doesn't want this kind of situation. If this kind of situations happen, we need intensive care, right? To make a little bit overcoming some of the tough situation. So let me introduce the materials, biomaterials, when you have a GBR procedure. This one is collagen graft. This collagen graft is already introduced by Dr. Zheng, the fully, right? However, this time, how can we apply this collagen graft more cleverly on our this daily practice, especially GBR procedure and GBR site? The Dentium collagen membrane got the lots of advantages. First, rapid soft tissue healing, open healing capability. Both of them are main advantages of a Dentium collagen graft. So we can utilize this kind of advantages. The resolvable collagen matrix came from porcine tendon derived, highly pure type 1 collagen, right? And key wound healing advantages are here: rapid epithelialization, the vascularization support, and the predictable resorption process. Okay, so let's see. We have some confusion or arguing about the barrier membrane, the conventional style collagen barrier membrane, and this collagen graft. What is big difference? Key differences are here. The barrier membrane working as main barrier function. And the graft, little bit different. Collagen graft directly induce a tissue integration, the total tissue integration, right? And another one is resorption period. The membrane, normally 4 to 6 months. Some of membranes are still longer. However, this collagen graft, around 1 month, stay there for the resorption. And the biggest one difference is here. The closed procedure, closed technique can be achievable using collagen graft. The healing approach is different, right? So if you want to use this proper action of collagen graft, we understand what is difference between collagen graft and collagen membrane, the conventional barrier membrane. And after that, we're going to put this collagen graft, the proper position, a proper action, and the proper case. First of all, let's see. This conventional GBR procedure looks like here, 3-wall defect. That is favorable defect to make a new bone formation, as you know. So put the collagen membrane and pin fixation. And this one is bright TL. So what about the collagen graft using GBR? Actually, a similar defect here, and implantation first, and then put the graft material, and then the damming with collagen graft looks like here. A little bit a different situation. The first, actually, the fixation method, and second, the healing process. So, collagen graft sometimes considered an excellent alternative to barrier membranes, right? So sometimes if you don't want to have the barrier membrane cause of big prep management or some different kinds of cases on some another difficulties, you can use this collagen graft instead of barrier membrane, right? That is a key today. Okay, what about the indication? Before saying the indication, let me introduce about this collagen graft from the Dentium company, a brand new product. Collagen graft have 3 different kinds of thickness. First one is 1D and 2D and 3D. That is from the collagen density, right? And the 3 millimeter and 2 millimeter, different thickness. 3 millimeter have a green color coding, 2 millimeter yellow color coding. Anyway, collagen density looks like different. Same dimension, same thickness. However, the collagen density is different, right? So we can divide 1D, 2D, 3D. And the physical property is more stiff of 3D compared to 1D. So depend on your usage and depend on your situation, you're going to choose the proper the density of the collagen graft. The indications are here. Actually, this collagen graft is all round prayer, like an all-round player. Everywhere, anywhere, you can put this collagen graft to get the better result and better outcome. First of all, I strongly recommend you this alveolar-rich preservation case for using collagen graft first. This collagen graft have a rapid soft tissue healing properties and open healing capability, as I mentioned before. So using these collagen graft advantages get the biggest and bigger the outcome when we have ARP situation. Okay, this case, simple case, okay? Just extraction and the put implant. Sometimes you can do the immediate implantation. This socket type is, as you know, the type B socket of molar, suggested by Dr. Tanau's classification. So some doctors want to have immediate implantation. However, some other doctors want to have an ARP. It depends on situation and the socket, the situation, and also your style. Anyway, this time we're going to do the ARP, to put the bone grafting on the socket, and the cover with collagen graft X1D, and the internal cross suture, and not any more deviation of the flap. So keratinized gingival zone still there here. So what is next? Healing. So during the healing process, maybe a little bit the compression and depression that will be happen. However, so faster epithelialization and also the granulation, the making the properties give us like looks like very nice the outcome. 4 months later, enough to have an implantation, the ready to implant installation here. So undersized drilling and implantation here, and sometimes we're going to do the connect with healing abutment, as you know. So final restoration here. So what do you think about this keratinized zone, even though the posterior molar area? So very nice. This keratinized zone, like soft tissue, the working and the effect, the acting situation and the contributing situation is more and more bigger, the important than the just the hard bone augmentation, right? So let me introduce later the later part of my presentation. Okay, the moderate case, vocal word total missing here. However, we're going to put the particle bone and collagenated bone, the appropriate A3, and then the cover with collagen graft X1D. And the suture, the open healing procedures was done, and 2 weeks later, the very familiar situation. During the healing process, you can see the frequently like this situation, like very similar to healing socket situation, right? So epithelium is merging each other, going each other, and the underneath side of the socket to make granulation tissues, the bottom of socket, the process, newly forming bone. The totally complex of processes are working during this healing process. Anyway, however, 4.5 months later, the very beautiful, very nice soft tissue healing site around here. Even though the vocal bone missing case, we can see very nice, well done, uniforming bone for this one. And next, implantation, very simple way. So initial drill and the undersized drill and the implantation. However, the keep in mind here, always try to host bone engagement in case of ALP, because of the just newly forming bone is sometimes unreliable. So for me, I always try to engage with host bone simultaneously. That is a safe way, and the healing situation and final restoration. So what do you think about around here? So good also. So a good emergency profiles will be get. Okay, My bone grafting packing protocol is here. It is not published. It's just for me, from my experience. I prefer to use particulated bone bottom and top portion, collagenated bone, and then covered with collagen graft. Yeah, that is very simple, however, the effective way to make an ALP procedure. So finally, sometimes fully tapered type supine is available, and like this one. Okay, let's move to a little bit the difficult case, severe case, the fistula around here. So this is not immediate implantation case, right? It is not candidate to immediate implantation. They have some risky. So extraction and the ARP first. So vocal bone were already gone away, so cover with collagen graft, totally damming with vocal bone area, missing area, and put the particulated bone, looks like here, and the lab around, hold the ridge with collagen graft. That is important factor, important key point, wrap around, hold the ridge, right? To keep in mind that if you want to use collagenated bone before wrap around the ridge, you can use also before the collagen graft putting. And suture. All of these procedures, very similar ice cream cone technique from Dennis Tanow, right? So 4 months later, good. And sometimes I'm going to use this PN, the gel application, to promote new bone formation and tissue healing, right? The very nice emergence profile, the gained here. Okay. What about the multiple case? Multiple case also that we're going to try like this, the Dentium collagen graft, cover the whole of this ridge. 1 week after, a little bit the tough style. However, 2 weeks later, maybe more the familiar. And then finally, we're going to do a very nice, well done, the coupled with keratinized gingival situations was seen. After ARP, 3 months, and then implantation with a second additional bone grafting procedure. So final restorations are here. What about this one? I emphasize this keratinized tissue, right? If you have the conventional style GBR procedure, big vertical and the periosteal releasing incisions and flap displaced to palatal and then replaced to buccal site, the very complex, and also this keratinized gingival zone and the attached gingival zone is gone away maybe. However, this kind of ARP procedures to make it easier. 1 year follow-up situation. Okay, sometimes I'm going to use CTG graft here, combined with the CTG, have some big defect. Collagen graft is good reinforcing materials. In case of insufficient CTG, sometimes thin biotype case, as you know, the CTG is not enough to cover fully root coverages or enhancing the keratinized gingival zone. So at this kind of situation, I always use combined CTG with collagen graft. And sometimes I can use collagen graft only. But anyway, when this kind of case, X1D is okay. However, only collagen graft, only case, I always try to X2D. X2D is more stiff and more stronger and the better result. Okay, during healing procedure. And what is result? Here, 7 months later, and some of clipping was seen and volume enhancement. So I think the biotype was changed using this CTG plus collagen graft. Okay, let's move to GBR case. What about this one? Also, this guide, the digital guide, have a great equalizer, right? Great equalizer. So even though the tough situation, we're going to more precise implant placement here. And after that, we're going to do GBR procedure, packing the bone graft material. And what is next? Membrane, right? However, in this case, actually, I try to use collagen graft X1D instead of barrier membrane. Why? Thin biotype. So if I got the periosteal releasing incision and vertical incision, maybe the lack of blood supply. So I worried about sloughing out the overlying the plaque, cause of lacking of blood supply. So changing my plan, so use collagen graft 1D. Collagen graft have two different layers, the dense layer and porous layer. The ordinary usage is a dense layer to face to outside. And the porous layer, the holding the blood clot, and also sometimes various vital cells holding actions will be seen. And the good at open healing, as you know, here, and the very nice healing situation was seen. So after PMMA and final zirconia prosthesis was applied to our patient mouse. But what about this area? Have some concavities here, so here, and the bone graft with collagen graft. And finally, I got the very nice, the cortical bone plate, actually the labial bone, newly forming bone around here. So final restoration and 1.5 year follow-up. Very nice. Okay, so Dentium collagen graft have lots of advantages, as I mentioned before. So first of all, that can be considered an excellent alternative to barrier membrane when the situation, tough situation, right? Okay, and that is summarized. For me, actually, the collagen graft is better when this kind of case. However, the collagen membrane is needed to the sinus augmentation. This one is a lateral window, the obstruction case. Okay, so the conclusion is here. Using the collagen graft conclusion is here. This material is complementary, right? Not competitive. The collagen membrane and collagen graft not competitive, just complementary to compensate each other materials. So this one is very nice and versatile graft materials. When you choose these graft materials, you can overcome more tough situation. However, current trend, something are different. First, bright TL. Bright TL edit, the method is more familiar and the more effect and the more productable, right? So how can I get the simple GBR procedure? Simple GBR always try to bright TL, to combine each other, make more synergy effect. But think about this one. The ugly and the tough situation, the lower anterior extraction and bone irregularity smoothened by using round bar or some another instrument, doesn't matter. And after that, insertion. This one, the bright TL. The two bright TL insert the proper position. And after that, damming this collagen graft, as I mentioned before, and the filled with the filled with osteon geno. This osteon geno came from a bovine bone, the cancellous bovine bone. The turnover rate is faster than just another company's bovine. So this osteon geno is my favorite bone graft materials also. And suture and healing, and we can get this just before the prosthetic procedure and maintain this thick keratinized gingival zone, and also very nice this ridge width. Okay, so what do you think about this one? The similar extraction to extraction of wrong position and failed implant already installed here. I don't know who made this kind of implantation around here. So anyway, GBR and simultaneously sometimes a staged approach, and some doctors want to have just only one implantation with cantilever. There are many different ways to have solved this kind of situation, as you know. For me, extraction, remove the fixture, and then after that, I have decided install the Bright TL. The Bright TL is already introduced by Dr. Zhang just before me. And the hex and external connection type here, I want to summarize once again these areas, 20-degree, the sloped external connection type, the unique implant connection. And the lower part, 1.5, have a room for soft tissue or some make a nice emergency profile area. And the thread is a fat belly style. The dome-shaped body is academic, academic style explanation. So for me, the fat belly style. So this middle portion of fixture gave us initial stability. So top portion of ridges reduce stress. So free from some of the compressive stress, it means we can easier maintain the crestal bone when we choose this Bright TL. As far as I know, always this kind of Graft gave us a lot of benefits. And after that, the bone grafting, and the Bright TL concept is here. Just one word, insertion at acceptable position. If possible, all the implant surface is surrounded by host bone first, and then the remnant of the space covers with bone graft and collagen graft. That is a simpler way, and the main concept of Bright TL and the collagen graft concept, right? So nowadays, more and more soft tissue, the focusing on soft tissue, the action, the long-term follow-up, long-term accessibility of implant survival rate. So the simpler way to have an implantation at any reach, and then focusing on the efforts more, this soft tissue bigger and higher, almost 3 millimeter is enough, is a necessary part according to the published paper, right? So soft tissues action, the working action is more important than any other before. So final restoration here, and the conveam CT view and final restoration looks like here. Okay. Maxillar. All the platform is the same, 3.8, right? Almost 4 millimeter. So it is enough to restore the posterior mandible and maxillar, doesn't matter, right? So just before Dr. Zhang mentioned about 3.5 diameter Bright TL, the support can support the molar replacement, right? So 3.5 is narrower and enough to hold the implant surface surrounded by host bone, right? Even though the smaller narrow reach, reduced reach case, and then just put the smaller diameter, 3.5, sometimes 3.0 is available. And then bone grafting is a stress-free bone grafting using this osteon geno collagen, also the coupled with collagen graft. That's enough. That's it. And then the wait, sometimes 2 months is enough to have a final restoration. So this is a full mouse case, and same concept. Same concept here, bone grafting, the field with some gap between fixture and the original bone height, and then the damming with collagen graft outside here, and suture. Oh, this one is a conveam CT view. It is not perforated here, and don't worry about it. Actually, bicortical fixation concept, healing, and the final restoration here. So That is my conclusion. So instead of word, I just want to show one picture. Bright TL and the bone grafting here, and the collagen graft. That is my the recommended and suggested recipe to make a simpler bone grafting and make a GBR the simpler way. Okay. Okay. Thank you for kind attention.